Some people feel that it is a waste of money to treat HIV/AIDS patients because they're going to die anyway.
It's no argument to say that people with AIDS are going to die, because that death is not inevitable. At one level, all of us as human beings are going to die. People with AIDS are under threat of dying sooner, but the point is that there is treatment available. So it's a very bad argument to accept it as inevitable.
Many medicines needed to treat HIV are cheap, but other medicines, like antiretrovirals, and medicines used to treat serious opportunistic infections are very expensive. Many doctors say they want to treat these diseases, but they are stopped by the high cost of medicine.
The drug used to treat cytomegalovirus is a drug called ganciclovir, and it is extremely expensive. It's probably costs more than 1,000 rand a day to treat a patient.
When it comes to antiretrovirals, the situation is even worse.
No, it is not feasible to give antiretrovirals to everyone at this stage, mainly because of current market prices. It's not affordable. It is not a thing that this government can even contemplate doing at this stage.
Then we read in our papers, our defense force, we bought so much arms, 2-something billion. Then we bought a submarine, but they saved 2-something million. It was supposed to be 29, but it's only 27 million they spent. They're investing on the sea, buying submarines. People are dying.
Some pharmaceutical manufacturers, like Glaxo Wellcome, say they have already offered their antiretroviral medicine to government at a discount of 70% on their world average price. Government says it still cannot afford these prices.
A pharmaceutical company has got a legal monopoly because of they invested money in the research and the development costs.
In this province alone, if you were to just treat 15% of the people who are HIV positive and treat them for with the sophisticated treatment that we talk about, the triple therapy, antiviral therapy as such, you would have to pay more than half the budget of the province on health, which means it is not possible, it's not affordable at this stage to give that type of treatment. That is where our first problem comes. Now, this is why there's been a big fight to say that the government should find it possible to buy medicines from other countries where it is cheaper, because then maybe we could get medicine at a cheaper rate so that you can then give it to people who are not employed.
This would be known as parallel importing.
Now, what parallel importing means is that if Glaxo Wellcome, for example, sells AZT in England at a price which is cheaper than what they want to sell it in South Africa, then our government may negotiate to buy the AZT from England or from another country rather than from Glaxo in South Africa.
Government could also use compulsory licensing to obtain cheaper drugs.
There is a possibility, if the prices for antiretrovirals are considered too high and are under patent legislation in many countries, including South Africa, to actually look at what we call a compulsory license, which is a license that the government can grant to another company than the original patent holder to produce and import the product into South Africa and make it available at a lower cost.
But government cannot do compulsory licensing and parallel importing just as they please, because South Africa has signed a number of international trade agreements as a member of the World Trade Organization. Under one of these agreements, called the TRIPS Agreement, governments have undertaken to respect the pharmaceutical companies' patent rights on medicine. However, TRIPS says if the prices of specific medicines are abusively high and there is a national emergency situation, governments can use parallel importing and compulsory licensing to get cheaper drugs.
Parallel importation and compulsory licensing are legal in terms of the TRIPS agreement within certain conditions. And I think manufacturers of drugs worldwide, and particularly those from the United States, have tried unsuccessfully to argue the opposite to that. But the World Health Organization in May this year, in fact, supported the interpretation that health concerns should override pure economic concerns.
In 1997, government passed the Medicines and Related Substances Control Amendment Act in order to do parallel importing and compulsory licensing. Almost immediately afterwards, the Pharmaceutical Manufacturers Association, or the PMA, who represents about 40 pharmaceutical companies, many of them multinationals, took government to court.
The PMA has challenged Act 90 of 97 particularly because of the provisions of Section 15C, which we believe and have argued in our court case allows the Minister of Health to take away our patent rights. And patent rights is that limited period of exclusivity which enables a pharmaceutical manufacturer or any innovator internationally to recoup their very substantial research and development costs.
But why are the pharmaceutical companies so up in arms about their patent rights?
To bring a product to the market, it takes around 12 years of research, which includes extensive clinical trials, funding of around 3 to 4 billion rand to bring one chemical entity successfully to the market as a medicine, as we know to be safe and effective medicine. And during that time, right at the very end of your clinical trials, you may find that the medicine fails for some or other reason, and that money is totally lost.
However, some say these claims about high research costs are not always entirely justified.
Much of the research has been funded by the United States government through the National Institutes of Health and universities within America. And when the product is finally proven to be effective, a license is awarded to a particular company to manufacture it. So there is an argument from many generic manufacturers that the patents held by those companies don't reflect years of investment, but merely reflect their luck to have got the license from the American government.
Even where companies have genuinely done research, it is not as simple as that.
Drug companies put a product onto a market at a price which that market will bear. I think one good piece of proof for that is how prices move when competitor products enter the market. So the pricing is not a simple reflection of input costs. It's a decision made within companies on the basis of quite what else is in the market and how that particular economy works.
The research and development argument says that drug companies need big profits to be able to explore scientific ways of combating other diseases, HIV and many other diseases which are life-threatening to us on this planet. But it's not a complete argument in the case of AIDS and HIV. Africa faces a human catastrophe with AIDS. We have nearly 25 million people on our continent who have AIDS and HIV. 4 million of them are in our country. This is a special circumstance. Whatever the research and development needs, whatever the research and development imperatives and costs of the drug companies, I believe that a special accommodation should be made.
The PMA's response to this argument?
If we believed it were a national emergency, would Section 15C have our approval? And the answer is no, because 15C is firstly and foremostly bad law. It ignores the Constitution of South Africa, it ignores the Patent Act of South Africa, it ignores South Africa's obligations under TRIPS.
Ever since 1997, this Act, which is a major aspect of our health law transformation, has been held up in court and has not been implemented because you can't implement it whilst there's a court challenge.
We have got to find a way of making treatment available through negotiations with the drug companies, through negotiations with the government, through pressure on the drug companies, through pressure on African governments and governments in the Northern Hemisphere as well. I believe that there is a solution to be found. My friends in the Treatment Action Campaign are constructively addressing those solutions, and I hope that we will find them very soon. Lives are being lost unless those solutions can be found.